Hello guys, a very good morning. Today let's get started on a very important basic topic, that is your antiviral drug. In antiviral drugs you have non-retroviral drugs and retroviral drugs. So today let's discuss on our retroviral drugs. So among non-retroviral drugs, among this non-retroviral we have anti-herpes, anti-influenza and anti-hepatitis. So in this video I'll discuss on anti-herpes and anti-influenza drugs. So starting off with your anti-herpes, you have four classification. One is your guanosine nucleoside analog. Second is your cytosine nucleoside analog. Third one is your thymidine. Fourth one is your pyrimidine nucleoside analog. So first is your guanosine nucleoside analog. So what are the drugs that comes under your guanosine nucleoside analogs? These are your acyclovir. Second is your ganciclovir. And third drug is your famciclovir, right? Yes. These are the drugs that comes under your guanosine nucleoside analog. So in our WhatsApp group, I have posted the PDF of acyclovir drugs. Acyclovir in detail. So just go through that also, because they can ask acyclovir as a separate 5-mark question, right? Yes. So going off with the mechanism of action of your guanosine nucleoside analog is that it inhibits the DNA polymerase and thymidine kinase. So acts on, or it inhibits DNA polymerase and your thymidine kinase. Okay. So before writing any drug, or if they ask a question about any drug, you have to know the mechanism of action of the particular drug, its uses, its side effects, and its the half-life. And these are the main points you have to know about the particular drug in whichever group you are writing, right? So mechanism of action of your guanosine nucleoside analogs are, it inhibits the DNA polymerase and thymidine kinase that is present in the particular virus. What is the mechanism of resistance? Mechanism of resistance meaning the particular drug will become resistant when there is a mutation of your DNA polymerase, or when there is an impaired thymidine kinase gene production. That is the most common one. So mechanism of resistance for this groups of drugs are when there is a mutation of your DNA polymerase, or when there is a impaired thymidine kinase gene production, right? This is the mechanism of resistance among this group of drugs. So first let's discuss on our acyclovir. I'll just tell the important points regarding the acyclovir. So prodrug of your acyclovir is valacyclovir. It is active against your HSV1, next is your HSV2 and your varicella zoster virus. So it is active against HSV1, that is herpes simplex virus 1, 2 and varicella zoster virus. Okay. So valacyclovir, that is your prodrug. Valacyclovir is a drug of choice for treatment of your HSV and your varicella zoster virus, right? Yes. Next, what are the main side effects of your acyclovir drug? So side effect of your common side effect will be this nausea, vomiting, diarrhea, rashes. These are the common side effects. The rare side effects of your acyclovir is renal dysfunction. Second one is your crystalluria. Third one is your neurotoxicity. These are the rare side effects of acyclovir drug. Suppose you are giving a acyclovir drug in an immunocompromised patient, it can also cause TTP or HUS in a immunocompromised patient. Okay. The half-life of your acyclovir is 3 hours in patients with normal renal function. Okay. So when you give a acyclovir drug, when you give it as an IV drug, you should use it for about 1 hour. It should be going through one period of 1 hour. You should not rush the drug. This acyclovir has a poor oral absorption. Right? Okay. Next, the main dosage I'll tell. Acyclovir dosage. Okay. Where did I write it here? Dosage for varicella zoster virus. If the child has a varicella zoster virus infection, whether you have to first identify whether it is a mild one or a severe one. Okay, if it is a mild one, you can give a oral tablet of 200 mg for 6th hourly. Okay, suppose if the child is having a severe varicella zoster virus infection, then your dosage will be 20 mg per kg IV Q8 hourly. So this is the dosage for an infant with the varicella zoster virus infection. That too for a child with a varicella zoster virus infection, you have same thing. You have to identify whether it is mild or severe. If it is mild, you can give the dosage of 400 mg Q6 hourly. Supposing if it is a severe varicella zoster virus infection, the same dosage, that is 20 mg per kg IV Q8 hourly is the dosage even for the children who are having a severe varicella zoster virus infection. This is regarding your acyclovir drug. Next you come to a cytosine nucleoside analog, that is your cidofovir. So what drug is your cytosine nucleoside analog? It is your cidofovir. So coming to cidofovir, mechanism of action of this cidofovir will be your, it blocks thymidine kinase. So this will block only thymidine kinase. Whereas your guanosine nucleoside analog, it will block DNA polymerase also and thymidine kinase gene also. While coming to cytosine, it is your only thymidine. It blocks only your thymidine kinase. Okay? Yes. So what are your uses of your cidofovir? So it is a drug of choice for the treatment of recurrent laryngeal papillomatosis. So it is a drug of choice for your recurrent laryngeal papillomatosis. First. Next, it is also used for the treatment of BK virus and your adenovirus infection. So it can also be used for BK virus and adenovirus infection that is seen usually in a patients with, usually seen in organ transplant patient. Next, it is also used for resistant herpes infection and for treatment of anogenital warts. What are its side effects? So side effect of your cidofovir is, one is your nephrotoxicity. Second, it can cause Fanconi syndrome. Third will be your anterior uveitis. Next, this is regarding your cytosine nucleoside analog, that is your cidofovir. Next, going on with the third group of drug, that is your thymidine nucleoside analog. Capital form. That is your thymidine nucleoside analog. So the drug that is coming under this group of classification is your idoxuridine. Okay. So idoxuridine, it also block, mechanism of action of this drug is, this also blocks only your thymidine kinase. Right? What are its uses? It is mainly used topically for the treatment of HSV keratitis, varicella zoster virus lesions. So it is used topically for the treatment of HSV keratitis and varicella zoster virus lesions. Right? Yes. Its side effect is cardiotoxicity. Your adoxuridine is a cardiotoxic drug. Next, coming of your fourth group of drug, that is your pyrimidine nucleoside analog. So in pyrimidine nucleoside analog, you have another group, another drug, that is your trifluridine. Trifluridine. So trifluridine, it is used. This is also used topically for HSV keratitis. And side effect, it can cause punctate keratopathy. Right? This is regarding your anti-herpes drugs. Next, main anti-herpes drugs, that is your guanosine nucleoside analog. Next is your cytosine nucleoside analog. Third one is your thymidine, and fourth one is your pyrimidine. Next, so among this anti-herpes drug, we have recent advances or other classes of your anti-herpes group. So other classes of anti-herpes virus. அதான் HS தானே எழுதியிருந்தேன். So other classes of antivirus herpes group of drug. First one is your foscarnet. Yes, going off with the foscarnet, mechanism of action is it blocks pyrophosphate binding site of DNA polymerase. So this blocks pyrophosphate binding site of DNA polymerase. So it is a drug of choice for resistant herpes virus. Next, its side effects are mainly your electrolyte imbalance. That is, it can cause hypophosphatemia, hyperphosphatemia, hypokalemia and hypomagnesemia. That is your electrolyte imbalance. Second is your formiversin group. So in this formiversin, the mechanism of action of your formiversin is it inhibits viral attachment and viral RNA. So it inhibits your viral attachment and viral RNA. So this is the mechanism of action of your formiversin. So this is mainly used for resistant CMV retinitis. Okay, so this is regarding your formiversin drug. Next is your next drug is your letter mover. Letter mover is your next drug. So mechanism of action is it blocks CMV DNA terminase. So it mainly blocks CMV DNA terminase. So it is mainly used as a prophylaxis of your CMV retinitis in a patient who have a stem cell transplantation. So mechanism of action of your letter mover is it blocks CMV DNA terminases and it is used mainly for the prophylaxis of CMV retinitis in stem cell transplantation patient. Okay, so these are the drugs regarding your anti-herpes. Next group is your anti-influenza drugs. So in anti-influenza drugs, first one is your M protein inhibitors. So the drugs belonging to your this category, that is your M protein inhibitors, are amantadine. Second one is your rimantadine. So amantadine and rimantadine are the two drugs that belonging to your M protein inhibitors. Mechanism of action of your M protein inhibitor is it blocks viral coating. So it blocks the viral uncoating. Okay, that is the mechanism of action of your M protein inhibitors. It is used for the treatment of influenza A. So treatment of influenza A. That is only if it is a known sensitive case of your influenza A, we use amantadine and rimantadine. Okay, so this is regarding your M protein inhibitors. Next is your next group of drug is your neuraminidase inhibitor. So coming to your neuraminidase inhibitor, mechanism of action is it blocks. So mechanism of action is it blocks your viral release. Okay, so the drugs that is belonging to your neuraminidase inhibitor are, first one is your oseltamivir, second one is your zanamivir. So these two drugs are belonging to your neuraminidase inhibitor. So oseltamivir, route of administration is oral route. It is drug of choice for both your influenza A and influenza B, and also for your bird flu. So oseltamivir, I'll write it here. It is mainly oral administration. It is used for or drug of choice for your influenza A, B, and also for bird flu. And you know the dosage for this, right? For adult treatment you use 75 mg BD for 5 days for treatment. For prophylaxis we use 75 mg OD for 5 days. In children it is according to the weight based. So it is mainly in children, it is mainly used for child more than 3 months of age. Okay, it is dosages regarding dosages mainly on your weight dependent. So side effects of your this oseltamivir is your nausea, vomiting. So this nausea, vomiting or this side effects can be avoided when you add when you give oseltamivir along with the food, right? Next is your zanamivir. So zanamivir route of administration is inhalation route.